Hi, welcome to Socialpost Health Channel viewers. I am Dr. Chava Anjaneyulu, Senior ENT Surgeon, working with Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having the laser facility which helps to treat all ENT problems from minor problems like any oral cavity growths to severe problems like laryngeal pathology, submucous fibrosis. Some people come with the problem of the ear discharge. Many of the times if patient is having a recurrent ear discharge, there is a problem in the eardrum and surrounding mastoid. This we call it as a chronic suppurative otitis media. This is the commonest cause of ear discharge from the ear. Most of the times along with the ear discharge, patient will complain of decreased hearing and tinnitus problem. So CSOM is the common cause for the ear discharge. Second common cause is if there is eczema in the ear, recurrent fungal infections will cause this problem, pus from the ear. So mainly whenever you have the ear discharge, pus from the ear, get examination by the ENT specialist. They will check your ear canal, eardrum, where we find exactly what is the reason for ear discharge. If only outer ear problem, eczema with fungal infections and otitis externa, we cure the disease by immediately giving medicines, and long term you should avoid entry of the water into the ear. If water enter into the ear, if already unhealthy skin, it will create problems like fungal infections and further bacterial infections and pus discharge. Especially in diabetes patients, this will lead to serious pseudomonas infections and which goes into the brain. So don't neglect if pus coming from the ear. The other common issue is the chronic suppurative otitis media. It may be due to perforation of the eardrum or bone infection, that we call it as a unsafe otitis media, mainly due to the cholesteatoma. So get examination, find out the reason. If there is a chronic suppurative otitis media, most of the times patient needs the surgery. It may be simple surgery like tympanoplasty, or sometimes if the disease is very extensive, erode the mastoid bone, we do the complete mastoidectomy. If you neglect this ear discharge from the ear, recurrent infections will cause the complete loss of hearing, that is sensory neural hearing loss. It is not good at all, and we cannot get back once the nerve is involved. So whenever there is a recurrent pus discharge from the ear, the inflammatory mediators will go into the ear through the oval window and rowl window. It will damage cochlear outer ear cells and damage the vestibular cells, cause the balance problems and hearing problems. So only otitis externa we can prevent by the avoiding water into the ear. If there is a perforation in the eardrum, we do the tympanoplasty, we clear that perforation and patient will get complete relief. If there is a cholesteatoma or unsafe CSOM, we do the mastoidectomy surgery to relieve the symptoms. If you have any ear discharge problem, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Socialpost Health Channel YouTube.